Hello viewers, this is Dr. Prashanjit Sarkar. I am an obstetrician and gynecologist dealing in high-risk pregnancies. I am attached to Bhagirathi Neotia Women and Child Care Hospital on Rawdon Street. Today's talk is about a very rare and interesting pregnancy, a very challenging pregnancy, where our patient, Mrs. Suparna Roy Sarkar, and husband Vishwatrish Sarkar had a very rare kind of problem with her pregnancies. She has a medical problem which is called SLE, systemic lupus erythematosus. In this case, the patient will have her own medical problems, but more than that, with every pregnancy, the child will have some kind of a problem because of this disease of the mother. Chief among them being a cardiac problem. The child, while inside the womb, will have a heart block, which will be a risk to the survival of the baby. So that is exactly what happened in their first pregnancy. So when the heart block was detected, due to this SLE condition, they went for an abortion at 20 weeks. But later realized that she will have this kind of a problem every time she is pregnant. So the solution is not an abortion. We need to tackle the whole problem for a happy ending. So this time also she became pregnant the second time. And here also, when the pregnancy was going on, the baby showed symptoms and features of heart block from 20 weeks onwards. So that was managed medically. But as the pregnancy progressed, at 28 weeks, the baby developed further problems. Like the baby's growth started decreasing. Next, the baby floats in a sac of fluid. The amount of fluid started decreasing alarmingly. And last of all, when we studied the oxygen supply, the blood supply to the baby from the mother through the umbilical cord, that blood supply started decreasing. The pregnancy was only 28 weeks. So we were in a very critical juncture. If we deliver the baby at that point, usually the pregnancy lasts 40 weeks and we can deliver the baby after 37 weeks because the baby becomes mature at 37 weeks. But this was 28 weeks. So if we go for delivery, the baby is premature severely, plus with all those problems, so we couldn't guarantee the baby will survive. On the other hand, if we delay the delivery, the baby might have a very bad ending inside the womb also. So we put together a very good medical team to come to a decision when we should deliver. The team included a pediatric cardiologist, that is a cardiologist who deals with babies. Number 2, a rheumatologist who will deal with the SLE condition that the mother has. Number 3, a fetal medicine specialist who will deal with the fetal problems like growth problem and the amount of fluid drying up. Of course, we had a team of neonatologists which was led by Dr. Shantanu Rai. Now, this whole team and the procedures was planned in Bhagirathi Neotia Rawdon Street Center because, as you know, this center is very well known for very excellent medical care, nursing care, and above all, very latest equipments in the NICU for baby care. So you need all those to tackle this kind of a rare and grave problem. So after the decision was taken that we are going to go for delivery at 28 weeks plus itself, then we had to give separate medicines to protect the baby's brain, separate medicines to protect the baby's lungs. So all this was done in consultation because we had an excellent team, excellent medical board to take that decision. Obviously, we also involved the patient and her husband in the whole decision-making procedure. But after delivery, the neonatologists led by the team, led by Dr. Shantanu Rai, did an excellent job. And I'm happy to say that by God's grace, we are looking forward to a happy ending. The baby has been in NICU for more than 2 months, but in another few days, maybe 7 days, the baby is going to be discharged. The baby was delivered at 28 weeks, weighing 600 grams, with a very little chance of survival. Now, the parents are happy that they have successfully become parents. Now, the real heroes of this whole saga has really been the patient Suparna and husband Vishwatrish, because they have gone through umpteen times through mental trauma and physical stress. So kudos to them that by God's grace they have got the child and the ending has been happy. The take-home message is this: because of the latest technologies available in Bhagirathi Neotia regarding baby care and mother care and the excellent team of doctors we have here, we could come to this happy ending. So you can be rest assured that we can deliver the latest care in high-risk pregnancies in such rare cases. Thank you.
Good afternoon, everybody. I'm Dr. Shantanu Roy. I'm a child specialist. Today I'll narrate a story of Suparna Roy Sarkar, who came to my busy chamber. She was very horrified and very depressed. She had a very bad obstetric history. She was suffering from SLE, seropositive, antibody positive, and in this present pregnancy, she had found that her baby to be complete heart block. Along with she had oligohydramnios and the Doppler flow was getting reduced. So all the things were going against the baby, and many of the gynaes has said her to terminate the pregnancy, but she bravely kept the pregnancy. So at the time, me and my fellow colleagues, the fetal specialist Arindam and Dr. Prosenjit Sarkar, all geared up with the mother and tried to prolong the pregnancy as much as possible. But at the age of 28 weeks, we find that the Doppler flow was getting reversed. So at the time, we had to terminate the pregnancy as early as possible, because there was fetal compromise. And we found the baby to be delivered at the weight of 600 grams with severe respiratory distress. So we put the baby on ventilator, started TPN and gave surfactant. And to be very true, with all the efforts of our sisters of Neotia, Rawdon Street, and the registers who work in Neotia, Rawdon Street are very great. They did a lot, day and night, work day and night, and started to improve the baby very fast. And we found the baby to be breathing itself without any support, even not with the oxygen. And we were very happy. And the complete heart block also was behaving very nicely, and there was no problem except the heart rate was a bit low. Sometimes there was fluctuation of heart rate, otherwise the baby heart rate was keeping well. With Amita Boda being the cardiologist, gave some good opinions and did some echoes, and the baby was coming well out of the crisis. But suddenly at the age of 1.5 months, again we had a bumpy rides. The baby suddenly developed respiratory distress. All reports were normal. We were really horrified. We put the baby on CPAP, but for the God's grace, it was probably a viral respiratory infection, and baby improved it with only CPAP. And today, the baby is without oxygen, feeding well by mouth, breastfeeding, and baby has gained 1.6 kg. So from a 600 grams, the baby has gained 1.6 kg. I'm really happy for the parents and their family members. This baby is going home. The God grace, and I'm thankful to all the registers and sisters for helping me to sending this baby home. Thanks to everybody. Thanks a lot.